Dr. Patterson here, and I'm completing a segment on urinary incontinence, overactive bladder. And what I'm going to do, I'm just start to take off some of these anatomical parts from our model so that you'll be able to see this liver. So you'll be able to see what the bladder looks like and what's happening in terms of the weight that's pressed on it. Now, this is the colon and small intestine. This is some abdominal fat right there, your pancreas. Okay, spleen is right there at the top. You're going to take that off. And what I wanted to mention was this also includes stress incontinence. And when medication, surgery, and cognitive behavioral therapy no longer is efficacious, then the patient will opt for a procedure called neuromodulation. It's an invasive procedure. So this is what the bladder looks like. And that neuromodulation, surgically, the surgeon will go in and implant electrodes right into the tissue here to regulate the nerves in this area, that part of the bladder. Okay, and so this process is kind of an uncomfortable procedure, expensive, but what we have is the process of regulating the nerves in the bladder, the muscles, ligament, and strengthening the tissue in the pelvic bases is PEMF, or pulse electromagnetic field therapy. It's a non-invasive, not as costly as surgery, definitely, not as discomforting as surgery, and it uses a magnetic field which reaches the entire pelvic basin here, all the bladder tissue and the entire pelvic basin, whereas the neuromodulation process only reaches where the electrodes are implanted. So it's not like it doesn't work, but you want to, sometimes there are distortions in the bladder, okay? Just look, it might be tilted or something like that. There may be certain distortions. It's cut away so that you can see it. But when we talk about the cause, you know, often what's looked at is childbirth, where there's pressure, weight, loosening of the pelvic ligaments in this area. See, so it might be off, it might tilt, what have you, may drop. So that's a cause. The weight from the fibroid might press on this here, causing constant urination if it's too heavy. The colon may press on it. Okay, so there's a weakness, you know, in terms of the supporting pelvic ligaments and tissue in this area. And as a result, you urinate more in terms of frequency. Now, you can kind of control that when you're young, but when you get older, you cannot control that. Now, one of the things that's overlooked, and I want to bring that to your attention, is voluntary suppression. It really starts in the brain, okay? So the cerebrum will send a signal that urination needs to take place to the pons in the midbrain right here. This signal goes down to the spinal column to about L3, which is behind here. The spine is behind all this tissue, about L3, and the nerves go down to this area that gives you the signal that you need to void. And so what happens is that over the years of voluntarily suppression with a job, you may not want to go, you're sitting constantly, you may have had children, you actually voluntarily suppress the urge to go and hold it. And this area right here, what these are called sphincters, it's the opening, they open their doors, they open and close the opening to the bladder and allow you to void. So when that is confused, when the sphincters become confused, when you get about 40, say 50 years of age, you may try to control it and you can't control it. It's very difficult to make it to the washroom. It just seems like you can't hold it. You may actually lose a little urine into the clothing. Even with sneezing, coughing, and strain, you'll begin to notice that there's a certain amount of leakage. This is in the 40s. By the time you get 50 or 60, it's almost uncontrollable. You have to have padding or underpants to counteract the smell or counteract the spillage over into the regular clothing. They do help quite a bit. So you want to make sure that you don't voluntarily suppress the urge to go if you can avoid it. Now, the other thing that we finished with last time was, like, we believe in multiple forms of care. It's much more beneficial when you use several different things to help any condition that you may have in the body. And we had mentioned certain supplements like the horsetail, B complex, the astragalus, all for ligamental support, Ligaplex 2. One of the things you eat, use your foods. Okay, here's corn on the cob. This brown stuff and yellow stuff, that's called corn silk. Okay, so as you peel this back, okay, they call it shucking corn in the old days. You can see there's a lot of silk in there. Take this out, don't throw this away. Take the silk, and I want you to dry it out and then boil this here. Make a tea out of the corn silk. When you make a tea out of this corn silk, what that corn silk will do, it will actually clean out your kidneys, clean out the ureters or the tubes that go to your bladder. It will clean out the bladder. All you need is something as small as a grain of salt down here to irritate your bladder, and you'll constantly have the urge to go. You can clean all this stuff out. Okay, well, a little corn silk tea. Okay, so I hope that was kind of helpful. That kind of cleared up some questions that you may have had. I believe I received about urinary incontinence, overactive bladder, stress incontinence, and you'll be able to put this into use. You may even want to utilize PEMF therapy in addition to some of the other therapies that you're taking. Always consult with your physician when you change therapies or you want to implement a certain type of therapy, and then see what happens with that. Okay, best in health.